Hello, I am Dr. Srikanth V. I am a practicing plastic and cosmetic surgeon. I practice at Clinique Belle and at Manipal Hospital. What are any lifestyle change problems which can cause strain on the lymphatic system? One thing that is very well known is gravity and dependency. That means if the limb or the body is kept down against gravity, then it will accumulate. Most lymphedema patients will notice that the lymphedema is less in the morning because they are lying down and the fluid has less pressure and it drains into the system, and as the day progresses, if they go to work or they're standing through the day, the lymphedema in the hand and leg increases. So what is the lifestyle modification that somebody should do? The person should find a way in his day-to-day activities to elevate the limb. If it is the upper limb, lift the hand. If it is the lower limb, have a small stool at a place of work where you can raise your leg for a few hours during your break so that the lymphatic pressure decreases. Once the lymphatic pressure decreases, the lymphatic clearance from that area is also more. The second thing is that you should be very regular in wearing your pressure garment. For example, if you're traveling in a bus, which is for a long distance, or in a flight or in a train, make sure you use the pressure garment so that where you're not able to elevate the limb for long hours of time, there is a continuous compression guard which you're providing so that it drains the lymphatic fluid. The third thing is to know how to do a manual lymphatic drainage. It's a simple skill. I'm sure your plastic surgeon and your physiotherapist will be able to explain it to you. It is a massage of the leg or the hand in a very specific way so that you can drain the fluid. And if this occurs in the genitalia, that is in the penis or the scrotum, scrotal support will help and go in a long way in reducing the swelling in the scrotum so that you are not made uncomfortable towards the end of the day. The other thing that patients with lymphedema should do is to make sure to have good personal hygiene in the limbs, especially the lower limbs. That is, every day in the night, wash the legs, clean the legs, inspect between the toes to look for any fungal infection, use fungal dusting powder regularly, clean and dry the leg, and make sure that it doesn't get infected. If you are using shoes, make sure that the socks are changed regularly. If there is any smell, look for a cause. Usually it starts with a fungal infection of between the toes or of the nail. Get in touch with your physician who will be able to give you appropriate treatment so that it doesn't worsen, so that you may land up in the hospital. All these kind of lifestyle changes will definitely make your life with lymphedema easier.